How do you think the robot prevents you from accidentally cutting things that you should not?
We have given it a haptic boundary. Now, nowhere will a robot go beyond this boundary.
How do you explain the advantage of this expensive technology?
Try to see the broader spectrum. Try to see the patient's recovery. Try to see the assurance that it gives to the patient.
You were one of the first, or probably the only doctor in India who has trained with FIFA.
I'm India's one of the first doctor to be trained on FIFA grounds for sports. So my another knack or specialty is into sports medicine, balancing.
So, Dr. Girish, welcome to the second part. Let's continue our conversation from where we left. You mentioned that in a robotic surgery, the soft tissue and the muscles which are cut are less. So, how do you think the robot prevents you from accidentally cutting things that you should not?
So this is such a wonderful question because during the beginning genesis of robotics, of course, see, every technology comes with errors. So when it started way back in 2009 onwards, it was contemplated in 2005-6, and the idea progressed. So initially, when the technology was developing, it went through a lot of hiccups. There are systems which image based or CT based reports were not there. So lot of evolutionary cycle went into through. But with this technology, what happened, with every mistake there was improvement, there was correction. Thankfully, when it got introduced to India, it was already the permutations and combinations were taken care of, and now what technology we hold is very much foolproof. So what we have with our system is that we have created a haptic boundary around the knee, around the joint or hip joint or knee joint or whichever way we are speaking. So what does this haptic boundary means? That means the area of working is been limited. So when we design this particular thing on our computer software one day before the actual surgery, we have given it a haptic boundary. Now nowhere will a robot go beyond this boundary. We are 100% sure about it. And because now we have a very defined margin to work into, we are rest assured that no other soft tissue will be cut, no other area which should not be invaded. So this all depends on a very precise navigation system. So a component of a robot has typically three things. Number one is the pre-operative computer console on which the planning is done. There are infrared cameras and a navigation system which captures and collaborates this pre-operative planning with the actual patient registration. So when we start a patient, we do a registration onto the particular patient's anatomical profile. There are some markers which are placed onto the bony landmarks which are captured by this infrared camera.
So, you think it is all AI involved in the robot?
So AI can prompt certain things. It is on our surgeon to accept the AI's recommendations or not. So the surgeon should be well trained. It is, again, I'm telling you, it's not the robot which does the surgery. The surgeon should have a very good understanding about the anatomical phenotypes and the variations which hold. So this captured information and the information which we receive from the CT are now collaborated. Now the surgeon decides with what to do with this information. So the surgeon will, now there's a tri-party agreement. The surgeon, the computer, CT-based computer console, and the robotic capture. So now again there can be this pre-operative templating can be tweaked in favor of the patient's recovery. And now that all the three parties are in sync, then we start, and then the robotic arm comes. So this robotic arm is again collaborated with this navigation system, and the commands are given that this is the haptic boundary and you have to work within this the margin, and that makes us very precise. But precision to a precision of 0.1 millimeter.
But ultimately, a robot is a machine.
Yeah.
So, it can always glitch. It can always reboot during the surgery.
Yeah.
So, as a surgeon, how do you prevent that?
So frankly speaking, that comes with what type of robot you are using, what
Okay.
type of investment you have done. In current market, we have so many robots available. In Indian scenario, as of now, there are 7 robots and few more in under development, under Make in India scheme. So there are so many technologies which come with their own way. So to be broadly classified, we have image-based robot and non-image-based robot. The technology what we hold here in Gleneagles Hospital, Mumbai Parel, is that we have invested into the most advanced, most expensive, and the pioneer of robotic joints, the company which actually initiated the robotic joints in this world. So we are holding that technology with us. This robot which we have is called Mako 4.0. In India, as of now, only Gleneagles with its other counterparts in Hyderabad and Bangalore hold this particular robotic technology. Maybe other hospitals may buy into it, but as of now, we are the only ones which are holding. So we have the most advanced robotic technology with us. Our robot is CT based robot. So each patient, the 3D CT scan of the patient is done before the admission of the patient. We do feed this particular patient specific CT scan. Even if there is a twin brother or sister to this patient and the patient comes onto the bed, the computer will understand this is not that identical patient. So we are that specific. We are on this, we do customization as per that particular patient's CT scan. So it is a CT based plan. There is a customization happening. There is a haptic boundary profile which does not allow us to err. Your question, will it glitch? I have been personally using this robot from 2017 and it has not glitched ever. But having said and done, we should not be completely blind on this particular and bang on this technology. So we have a fail-safe mechanism also. Okay. So every step is calculated, every step is pre-minued, and we can stop any point in moment. If we feel that there can be an error, we can stop. And hence, our conventional techniques do kick in.
Yes.
I have been trained on conventional before. It's not that I have trained on robotics. Right. So conventional techniques are true, hold true, and anytime a surgeon should be in capacity to take over the robot and eliminate his decision. And this technology allows us to do that.
No, but with the most advanced technology comes the cost involved also. It is a big investment. And how do you explain the advantage of this expensive technology compared to the conventional surgery with the normal experienced hands of decades of experience of a surgeon?
So you are absolutely true. With greater technology, will some price range be added up to it? And I am absolutely in sync with you. But try to understand when you just compare the surgical expenses intraoperative or during the admission, it may feel a little bit higher as compared to the conventional surgery being offered. But don't see this. Try to see the broader spectrum. Try to see the patient's recovery. Try to see the assurance that it gives to the patient. Try to understand the joint replacement. You may have relatives and friends who would say, "Ki, we did it at the best hospital, we did it at the best surgeon, and still we are not very happy. This joint does not feel natural. We still have limitations. What if we could eliminate this particular post-operative trauma?" Number one. Number two, post-operative rehabilitation. Patients are, even in today's world, having an experience of undergoing physiotherapy, struggling with their activities, even 6 months post-surgery, some people even years after surgery. What if I could say that the requirement of this particular effort is minimalized to hardly 2 weeks? What if I could tell you we have patients, frankly speaking, more than 90% of the patients who would go home without a walker support? What if I could tell you that I have patients which would show a unlimited free gaze walking from the day of surgery, who can take staircases, who can do commode chair, who can go home happy, feeling that the surgery was never done? What if we can have a group of patients who say, "I don't even feel that I have been operated"? Now that is what is true success, and this particular result is definitely worth for all the expenses that you can do.
Right. So coming to, I was going through your profile and it said that you were one of the first or probably the only doctor in India who has trained with FIFA, and you have been using this robotic technology many years prior to when this technology actually came to India. So can you shine some light on your journey as a robotic surgeon?
So yeah, I did my undergrad, postgrad from India itself. India is a beautiful country and the medical system that we hold is amongst the best in the world. We have beautiful medical colleges and best of all, we have a very high volume of surgeries. So my formal training is from India only, and that gave me a very good confidence to apply all type of so in India we have, as I told you, we are spoiled by choices.
Right.
We have all the MNC companies pouring their technology and implant into our country. So each implant, each design comes with a particular, what is a rationale to it.
Right.
And we have so much variety of patients. So in India, I got a knack of understanding and creating algorithms as to what type of design principles or what type of alignment philosophies will be standing true to that particular patient's phenotype. I was 6 years abroad. I had very good experience trying to. The reason I went abroad is to gain that Western technological advantage and applying those principles. I always wanted to come back to my country. So going out, very luckily, this technology, when it was introduced to the UK, I had an access to it. I went into training. We offered some academics and research papers which went into the formulation and development of this technology as well. And that gave me a knack of understanding how this particular technology will hold true to your alignment principles. I'm India's one of the first doctor to be trained on FIFA grounds for sports. So my another knack or specialty is into sports medicine, balancing the peri-articular soft tissue coverage of the joint. This again gives me a edge to perform joint replacement, balancing the soft tissue coverage around it. So combining all the principles, training across very prestigious institutes like Glasgow, Scotland, at King's Medical College, London, UK, at FIFA grounds, Porto, Portugal, Helios Endo Clinic. Thankfully, the way it was training process gives me that particular training to offer that. And at Gleneagles, the hospital is so well equipped with all the logistics. We have a superb anesthesia team. We have a superb emergency department headed by you. So we show such a good multidisciplinary approach to each and every patient that walks into our OPD to offer them the best-in-class treatment.
I'm sure with the latest technology, with you being around and all the support departments, it will offer the best outcome to all our patients.
So, yeah, Gleneagles really is a tertiary care center where all these experts like yourself, like our teams that we have here, like the physiotherapy department that we have, the logistics and the administrative support which the hospital offers, the human touch always have a upper hand over any technology that can come. The empathy that we hold towards our patient, the class of treatment that allows our patients to be that comfortable with the healthcare system. Nowhere in the world is offered what we offer to our patients, and it truly gives you that advanced touch to your clinical care.
So, Dr. Girish, we have covered a lot of ground today, right? From the technology in the operation room to the road to the recovery. And a big takeaway is that robotic technology is not replacing the surgeon, it is just there to empower you even more. And I'm sure this is the way forward. So, whether patients opt for a robotic or an open surgery, the most important step is to taking the first step to living without pain. And I would like to thank you for showing your expertise and sharing us your insights on robotic knee replacement. And I'm sure a lot of patients will gain out of it. I am Dr. Mohit, your host. Just to remind you that movement is medicine. Thank you for listening. And if you have your friends or family who are suffering from pain and would like to seek care, you're most welcome at Gleneagles Hospital, Mumbai. Thank you.
Gleneagles Hospitals, where good people make you feel better.